Children and Adolescence Part 2. Attention Deficit Hyperactivity Disorder, ADHD. Essential features of ADHD include developmentally inappropriate degrees of inattention, impulsivity, or hyperactivity. So this can be a combination of all three, or it could be predominantly inattention, inattentive presentation, or predominantly hyperactivity along with impulsive presentation. So, predisposing factors for ADHD. Our biological influences include genetics, biochemical theory, anatomical influence, perinatal, prenatal, and postnatal factors. Predisposing factors for ADHD include environmental influences such as exposure to lead and dietary factors. Psychosocial influences include disorganized or chaotic family environment, maternal mental disorder, paternal criminality, low socioeconomic status, and unstable foster care. Assessment of ADHD. So, difficulty in performing age appropriate tasks, highly distractible, extremely limited attention span, and impulsive behaviors. So, assessment continues. So, the client may have difficulty forming relationships. They may demonstrate behavior that inhibits social interaction. They may have disruptive, intrusive behavior in group settings. They may have excessive levels of activity, restlessness, and fidgeting. They may be accident prone, have a low frustration tolerance, and temper outbursts. Comorbidity ADHD. So, comorbid psychiatric diagnoses are prevalent with ADHD. Common ones include oppositional defiant disorder, conductive disorder, anxiety, depression, bipolar, and substance use disorder. Comorbidity continued. So, depression and anxiety may be treated concurrently with ADHD patients. Our substance use disorder and bipolar disorder must be stabilized before beginning treatment for ADHD. So, nursing diagnosis for ADHD. Risk for injury related to impulsive, accident prone behavior, impaired social interaction related to intrusive immature behavior, low self esteem related to dysfunctional family systems and negative feedback, noncompliance with task expectations related to low frustration tolerance and short attention span. So, the goals for our ADHD patient is to remain safe, so no physical harm should be experienced. They need to interact with others appropriately, verbalize positive aspects about themselves, demonstrate fewer demanding behaviors, cooperates with staff in the effort to complete assigned tasks. Nursing interventions for the child with ADHD are aimed at ensuring the client remains free of injury, encouraging appropriate interactions with others, increasing feelings of self worth, fostering motivation for compliance with tasks. Please refer to Table 23-4 in your text for comprehensive care plans. And we have ourselves a question. An adolescent diagnosed with ADHD is having difficulty maintaining concentration in the inpatient milieu. Which nursing intervention would help improve the client's task performance? A. Mandate that the client remains in his room until all homework is complete. B. Remove privileges if homework is not complete within 2-hour period. C. Encourage dividing tasks into smaller, attainable steps and reward successful completion. D. Seek a physician order to discontinue the stimulant Ritalin. I'll give you a minute. And you are correct. C is the correct answer. A client with short attention span can be overwhelmed with large tasks, so it was good to break them down into small tasks and to reward them rather than punish them. Evaluation for our ADHD clients. Evaluation involves examining clients' behavior following implementation of nursing actions to determine whether goals of therapy have been achieved. Psychopharmacological interventions for ADHD. So the psychopharmacological interventions and particular stimulants, and we have on this slide our central nervous system stimulants and their side effects. They are considered first line of treatment for ADHD clients. The mechanism of action is unclear, but these drugs are known to elevate dopamine and norepinephrine levels, and it has been hypothesized that their effectiveness is in response to these neurotransmitter deregulations. They have generally mild side effects, but they are contraindicated in people with cardiac problems or at risk for cardiac problems. So one study explores whether stimulants have an impact on reducing injury and hospitalization admissions for children with ADHD. They found that children with ADHD drugs, mostly stimulants, had a twofold higher risk of injury related to hospitalization admissions than those that were not treated with ADHD drugs. They found that children who were on ADHD drugs and psychotropic drugs such as antipsychotics and benzodiazepines, are 5 times more likely to have injuries. So, children on ADHD drugs had a higher risk for injury related hospital admissions. And a complete discussion on medication used to treat ADHD can be found in Chapter 24, which is not on our schedule for this particular course. Tourette's disorder. The essential feature of Tourette's disorder is the presence of multiple motor tics and one or more vocal tic. Onset may be early as 2 years old, but occurs most commonly around the age of 6 or 7. The disorder is more common in boys than girls. Predisposing factors to Tourette's disorder. So it is believed that for biological factors, it could be a genetic factor, predisposition, as well as biochemical factors and structural factors. Then we have our environmental factor. So that could be complications related to pregnancy, low birth weight, head trauma, carbon monoxide poisoning, encephalitis. Simple motor tics include eye blinking, neck jerking, shoulder shrugging, and facial grimacing. Complex motor tics include squatting, hopping, skipping, tapping, and retracing steps. Vocal tics include words or sounds such as squeaks, grunts, barks, sniffs, snorts, coughs, and rare utterance of obscenities. Then we have paulalia and echolalia. So paulalia is repeating one's words and sounds, and echolalia is repeating what others say. The next few slides will talk about the nursing process for Tourette's disorder. So this slide begins with nursing diagnosis and outcome identification. So we have risk for self-directed and other directed violence related to low tolerance for, for frustration, impaired social interaction related to impulsiveness and oppositional and aggressive behavior, low self-esteem related to embarrassment associated with tic behaviors. So the outcomes or goals for our Tourette's disorder. So we want to make sure that it's a safe environment, the client is safe, and those around the client is safe. The client should be able to interact with staff and peers appropriately, demonstrate self-control by managing their tic behavior, verbalize positive aspects of themselves, and follow rules without becoming defensive. Planning, implementation, Tourette's disorder. Nursing care of the client with Tourette's disorder is aimed at safety for the client and others, encouraging interpersonal relationship development, and promoting feelings of self-worth. So the evaluation process for our Tourette's disorder diagnosed client, the evaluation of the care for a client or child with Tourette's disorder reflects whether the nursing actions have been effective in achieving the established goals. Pharmacological interventions for Tourette's disorder. So the pharmacological interventions for Tourette's is most effective when it's combined with other therapies such as behavior therapy, individual counseling or psychotherapy, or family therapy. Common medications used for Tourette's disorder include antipsychotics and alpha agonist drugs.